Great. So I'm David from the Northumbria Healthcare Trust. I've put on screen, this is the list of that are there, but I'm David, one of the paediatric diabetes nurses, and also Jenny Coltman's in here with me as well, just to help go through things. So first thing is what our purpose is. So we first looked at QI and we had sort of a feeling about where we felt our team was the weakest, where we sort of needed the most improvement. And through sort of a general discussion and looking on how things were, we decided that transition would be sort of our main focus, and certainly transition in terms of clinics as well and what we did. So the people who will benefit from this will be our patients, really, will benefit from them, and we start transition from 14 to 18 years old. So it's looking specifically to benefit those in their outpatient experience. So who we connecting with to improve our work? So at the beginning of the process, we decided to involve our Trust's QI team, of which we have one, and there was a lady that come along to help us with our teams and in our team meetings called Angela, and she gave us a lot of advice and guidance and a bit of structure to our meetings so we could help make a start on things and make better use of our time with QI. So she also helped us do a process map for the whole transition process of our 14 to 18 year olds, as well as her sitting in some of our clinics and timing sort of how they actually went physically, the clinics. So our journey so far, we looked at the challenge that we had of trying to get the whole team together, actually, and getting everybody together and finding the time to do QI. So what we did was we initially added 30 minutes to our MDT meetings, which were monthly, and decided just to have the first 30 minutes of MDT talking specifically about QI. So after doing some of these meetings and talking around transition clinic, we devised, with the help of Angela, our process map for clinics. Now, this is a very small picture, I appreciate, and I don't expect people to be able to read it, but the main thing really is these yellow bits across the top here. They are sort of all of the little milestones that someone will go through whilst they're transitioning from 14 to 18, and the pink squares, they are sort of what comes off what milestone, essentially, of where there are problems or issues that we needed to address. So really just looking at that, there was definitely one column that had more pink squares than anything else. And these squares here were relating to what we call our transition planner or our transition questionnaire. So the questionnaire was devised by our psychologist, Gail W. Pierce, a little while ago, and it's a little leaflet that the child or young adult would go through and would see how they're feeling on certain things. So managing their healthcare, communicating with their team, things around sex and alcohol, that kind of thing, and how they felt about it and how confident they were. So it was really devised as a bit of a talking tool to do this. But when we looked at it sort of and looking at our it's how this is implemented, it was relatively a long time ago when this was made, and with team turnover there was questions that came out. So we had questions like, it was unclear who actually filled out the questionnaire, whether we give it to the child themselves to fill out and then we question it later, whether a doctor did it with them, even should it be a doctor or was it a nurse's job, and really where it's kept. So there was a lot of questions really about this planner, but we did quite like the questionnaire and planner as a tool. So it gives us our.
Sorry, David, you're 3.5 minutes.
Okay, so at our first job that came from that, we decided to audit our records, so have a little look through to see how these have been filled out and where they were. And the results that we got from it weren't very good. We couldn't actually find any of the completed questionnaires in any of the notes, so that was a bit of a shock. But we felt like it was a shock for the team. So actually discussing it, we do have memories, and we're fairly sure that we have gone through this with patients through the questionnaire and even filled them out with them. But as to what happened with them, I think sometimes the patients would keep them, or sometimes they were handed out to the patients to fill out at home and they would never bring them back to clinic. So we didn't actually have any sort of filed evidence of this, which was a bit of a problem. So it's sort of through that we developed what our actual QI project is going to be about. So we're doing a transition checklist. So our idea for this is that it is a type of passport that will live in the medical notes. And what it will do is it will tick off every milestone that the child goes through their transition journey. And we looked at the questionnaire and we decided that we would hand out the questionnaire not when they turn 14 at their annual review, so we felt that was quite busy. We decided to do it at the clinic after. So we give the child the questionnaire to fill out, and then we start to document exactly where we got through with them in that questionnaire. So we can see on that transition checklist over here, we put in the date that it's achieved, but also an area so that we can comment on how they felt about things, if things needed addressed again the next time. So really what we wanted to do, and what we've achieved with this, we hope, is sorry, I've gone too far, is a tool that will let any healthcare worker sort of pick up the notes and can see this checklist as well as the planet and see exactly where they are up to through discussing this questionnaire and also the transition process as a whole. So how have we improved our team working? So through doing this, we did find that our meetings to talk about QI wasn't quite enough because we were meeting once a month for 30 minutes. So we decided that we needed to allocate more time. So we decided to double it. So we would meet twice a month, and the next time that we were all generally together was before our clinics on a Tuesday as well. So we decided to meet for an extra half an hour just before the handover in clinic to go through QI then as well. As you could see from the process map, there was a lot going on from there. So actually what it did allow us to do, as much as we've taken that transition questionnaire and the passport that we've developed, there is a lot more that we have found through that we know that we need to develop. So it's improved our sort of team working in so that we've found more areas to improve and know that we need to do more going forward. Now, it would be remiss of me not to talk about COVID. COVID did absolutely affect how we did QI. We're just discussing it slightly before we did this presentation. But what we did find is that we had to kind of meet through Teams quite a lot to do that. And some people were, outside of the area or working from home. But we did find that through QI and talking about things, it did help us develop how we were going to conduct our clinics through lockdown, because we were already looking at the clinic. So it helped us look at how we were actually going to do our clinics as a whole. So it did help the QI process us looking at that.
You're at 7.5 minutes.
Great. So the most important piece of learning that we looked at so far was that we did find that the transition process, whilst it would generally happen, we absolutely couldn't really track where we were up to. So if someone was, say, 16 years old, it was very hard for us to find exactly what they had done and what they had left to do. So I think that's our most important thing, and we've devised tools to stop that and help us out with them. It did help us look at, sorry, that's the other healthcare bit. There was something else I was going to say there and I've not got it. My apologies. But no, we did look at the transition process really as a whole. We did identify that really we need to address that. So that is what the passport was for. So these are the questions that we would like to know from the other team. So what we want to know is really, how does your team track transition through the process? How do you know what sort of stage they're up to and where they're going to? And also, how and when do you discuss with the child and their family sort of the differences between paediatric and adult services, like when that conversation takes place? And that's what we've got.
Thank you.